We'll get going in a couple minutes. We'll let everyone else sign in.
I just texted you because they have plans to go to the library, so he doesn't want to go. He wants to hang out with them. All right.
Give it another minute and then we'll get started.
I will have to check with the fire department for availability.
All right, it seems the beeps to have people come to the meeting have stopped, so we'll call this meeting to order. Adequate notice of this meeting pursuant to the Open Public Meetings Act, NJSA 10-4-10 has been complied with and shall be entered into the minutes. We'll go ahead now and introduce ourselves. My name is Melissa Bellamy. I work for the County Division of Housing, and I am chair of this committee. Eileen, you want to go ahead?
Sure. Good morning, everybody. Eileen O'Donnell, Director of Coming Home and Vice Chair of this committee.
Okay, great. For everyone else, I'll just ask you to do your names. I'm going from the group list, so it's in alphabetical order, depending on whether you put your first name first or your last name first. So the first person I see on my list is Carolyn. You want to unmute and introduce yourself?
Good morning, everyone. I always have tech issues, so forgive me. Carolyn Timmons, Robert Wood Johnson Hospital Violence Intervention Program.
Thanks for joining us, Carolyn. Cassandra?
Cassandra Jones, Coming Home in Middlesex County, Lead Access Navigator.
Thanks, Cassandra. Catherine C.
Good morning, Catherine Cintron with Women Aware.
Hi, Catherine.
Hi, good morning. Catherine Jackson with Catholic Charity Sizes Settlement Touching.
Good morning. Claire Meese.
Good morning, everyone. Claire Mees from Coming Home Access Navigator.
Thanks for joining us. Crystal?
Good morning, Crystal Crawford, Coming Home Access Navigator.
Great, thank you. Deb?
Good morning, Deb Kaufman with Triple C Housing.
Hello. Delicia? If you want to unmute yourself, and I hope I'm pronouncing your name right, Delicia. Okay, we'll go to Aaron.
Did you say Erin?
Aaron, yes, sorry.
That's okay. I just wasn't sure. Sorry, I just hopped in. We're doing instructions.
Yes, just a quick intro, name and agency.
Erin, Program Manager for Volunteers of America.
Great, thanks, Aaron. Nicole?
Hi, everyone. Nicole Fernandez from Catholic Charities Diocese of Metuchen.
Thanks. Frank?
Frank Cunningham, Beginning World Changes.
Thanks, Frank. Henry?
Henry Busby with Middlesex County Veteran Services.
Thanks, Henry. Catherine J.
Me again? I'm sorry.
Yeah.
I already
Did
went.
you? Oh,
Yeah.
Oh, you know what? There was another Catherine before. I didn't
Yes.
see. Oh, so all right. So we already got Catherine.
Hello, Catherines.
3 Catherine. So Catherine Community Hope.
Hi, this is Catherine from Community Hope. I'm their outreach specialist. Good morning, everyone.
Thanks. Good morning. All right, get my brain going today. Janie.
Sorry, my mouse decided not to work. Janie Kazazian, Volunteers of America.
Right. Thanks, Janie. Jason. Hey, you're unmuted, Jason, but I'm not hearing you. All right, might just be having some technical difficulties. It's that kind of day. Jean Marie.
Good morning. It's Jean Marie Leach from Rutgers UBHC.
Thanks, Jean Marie. Pretty background. Jennifer.
Good morning, Jennifer Amaya, Director of Outreach and Prevention, Revisions and Pathways.
Thanks, Jennifer. Casey.
Hi, everyone. Casey Venkowski, Monarch Housing Associates.
Hi, Kayla.
Good morning, Kayla McKellen, Coming Home Access Navigator.
Hi, Keith.
Keith Jones, City of New Brunswick.
Hi, Keith. Thank you. Jason indicated Jason Jones is from Shiloh. His mic wasn't working. So welcome, Jason, and welcome, Keith. Kenya.
Hi, everyone. Kenya Lamar from Monarch Housing Associates.
Thanks, Kenya. Lori.
Hi, Lori Friedman, RCHP Affordable Housing Corporation.
Hi, thanks, Lori. And the other Lori.
Hi, good morning. Lori Giancatino, representing the Special Childhood Services for the Middlesex County and also the Center for Empowerment.
Wonderful. Thanks for joining us, both Loris. Linda?
Good morning, Linda J. Middlesex County Board of Social Services.
Thanks, Linda. Lisa?
Good morning. This is Lisa Barnes, Member Advocate for Horizons MLTSS program.
Thanks, Lisa. And Lewis?
Good morning, everyone. Louis DiLucci, Garden State Home.
Thanks, Lewis. Marco?
Good morning, everybody. Marco Zelaya, Homeless Program Manager for NJ211 Partnership.
Thanks, Marco. And Mike?
Mike Gildenberg said his microphone is not working.
Oh, okay. Well, and well, then go ahead, Michelle. You were next in line.
Okay. Good morning, everybody. Michelle Graybell, Homeless Program Supervisor for Middlesex County.
Great. And hi, Mike. Millie?
Good morning, Magdalia Figueroa, Coming Home. How's everybody?
Good. Thanks, Millie. Rita?
Morning, everyone. I'm a program manager at DCA Office of Homelessness Prevention.
Thanks. Ola? Ola Milliken? I don't know if you're able to unmute. All right, we'll move on then. Paula?
Hey, good morning, everybody. Paula, Volunteers of America.
Thanks, Paula. And Ray? If you can unmute, Ray.
Hi, Raymond Flores from the Puerto Rican Association. Good morning.
Good morning, thanks. Raina?
Good morning, Raina Garcia, Outreach Representative at Grupo Health.
Thanks, Raina. Samari?
Good morning, everyone. My name is Samara Rivera, Chief Housing Officer for St. Clair's and the New Jersey Housing Collaborative.
Great. Sandy?
Good morning, Melissa. Good morning, everyone. Sandy Batoni, Senior Program Manager at the Middlesex County Office of Workforce and Career Development.
Thanks, Sandy. Hyrule?
Good morning, Hiral Shukla from Aetna CVS Health. I'm a social terms of health community strategist. Thank you.
Thanks, Hero. Sylvia?
Good morning, Sylvia Costa, DCPMP.
Thanks, Sylvia. Evelise?
Hi, good morning, everyone. My name is Evelise Bart, County Liaison from Middlesex County from the Office of Program Operations, DHS.
Thanks. Stephanie?
Good morning, Melissa. Good morning, everyone. Stephanie Evans from Rutgers UBHC Case Management Department.
Daisha?
Timing is impeccable, isn't it? There,
Perfect,
Melissa?
Right?
Yes. Station Neils, Rutgers UBHC. Good morning, everyone.
Good morning. Good team from UBHC today. Very excellent. Steve.
Good morning, Steve Nagel, Executive Director of Home Sharing. And I don't know if you know this, Melissa and I are in the same building today, just on opposite sides.
Ah.
Behind you.
Yes, we are. Susan.
Good morning. I don't recognize Steve anymore. He's lost so much weight. Congratulations.
Thank you, Reverend.
Good morning, Susan Kramer Mills of Town Clock CDC.
Could discuss the way they do because she puts out.
Great. And Tahina.
Good morning, Taina Pacheco from the YMCA, Resource Navigator.
Thanks, Tahina. Talin.
Good morning, everyone. Talin from Coming Home of Middlesex County.
Thanks, Talin. Tanya.
Good morning, everyone. Tanya Asma from Zufo Health Community Outreach.
And Tia.
Good morning, Tia Rogers from Coming Home, Case Manager.
Thanks, Tia. Amaya.
Good morning, everyone. Elmia Walker, United Healthcare.
Thanks, Elmia. And Zena.
Good morning, Zena Sutton with Edison Housing Authority.
Go back up to the top and get anybody I missed. Amanda. Amanda Lyons, want to introduce? She's unmuted. You might be having mic issues. Amanda's from the Middlesex College. I see somebody called in with a phone number ending in 9428. If you haven't already introduced yourself, you can unmute and do it now.
Good morning, Corey Benatti, Field Supervisor, Soldier-On.
Hey, Corey, thanks for joining today. Is there anybody else I missed? You can unmute and introduce yourself.
Cortland Cobb, Coming Home.
Hey, thanks, Court. Nice
Jennifer Roach
joining
from
in.
the YMCA.
Oh, Jennifer, excellent.
Melissa Lewis from the County Office of Human Services.
Perfect. All right. Thank you.
Francis O'Toole, Coming Home.
Oh, thank you. Coming Home well represented today. Excellent. I'm going to do a screen share for the agenda. So let me do that. And I'll continue just by giving our mission statement. The mission of the Middlesex County Housing Continuum of Care Committee is to stimulate community-wide planning and coordination of programs for individuals and families who are homeless and unify and coordinate efforts to end homelessness in Middlesex County, New Jersey, so no one will experience homelessness and no one will be without a safe, stable place to call home. Next on the agenda is the minutes from our June 6th meeting. You will remember we did not have a July meeting, so we gave everyone a break. But Michelle prepared the June 6th minutes, so if I can get a motion and then a second to approve those minutes.
As Carolyn Timmons, I'll make the motion to approve the minutes as presented.
Thanks, Carolyn.
I'll second it.
Thanks, Steve. Is there any discussion, any questions? If not, you don't all have to unmute. We will go with the assumption everyone will approve. And if anybody has any no's or abstentions, you can unmute or you can note them in the chat. Okay, next we're going to go to an agency spotlight, and we are going to spotlight home sharing. Executive Director Steve Nagel will give a little presentation. I think you have something to share, so I will stop sharing.
Thank you. And I will start, hopefully. Bear with me 1 second. For some reason, the presentation, this always happens to me on Teams. The one thing I need to share isn't here for some reason. So please bear with me 1 sec. There it is. Now, hopefully, you can see the show.
Yes, we can.
Yeah, because sometimes I have an issue that when I show this, it doesn't advance. So if it doesn't advance, let me know. So here's our first slide. Can everybody see that?
Yes.
Good. We were
Yes.
established a little over 40 years ago, started in Somerset County, and Home Share expanded to begin serving northern New Jersey residents in 2001, starting in Middlesex. Our mission is to create affordable housing solutions by matching those seeking housing with those who need additional income or services to maintain their homes while fostering independence and dignity. We're currently in 11 counties in central and northern New Jersey, began an expansion program in Monmouth and Ocean that has already started paying dividends for us about a month and a half after we started it. Home sharing is a permanent housing solution for those who have a home and need additional income, companionship, or help to remain in their home, or those looking for more affordable housing and are amenable to living in someone else's home. And all our services provided at absolutely no cost to our clients. One of the things we do is we get to help combat social isolation and loneliness. It has been proven that nearly 1 in 5 adults over the age of 50 is at risk of social isolation. Subjective feelings of loneliness increase the risk of death from 26 to 45%. And the health risks of prolonged isolation and feelings of loneliness are equivalent to smoking 15 cigarettes a day. I thought that was an absolutely amazing statistic, and I wanted to share that with everybody. Our program parameters, the person who is looking to live in someone's home, we call them a seeker, will receive a private room, private or shared bathroom, and share other common areas of the home like a kitchen and living room. They're not just renting a room from a homeowner. It's not a landlord-tenant or a homeowner-boarder situation. It is actually a relationship between two people living together, sharing a home. The seeker has to have consistent income. Our average income, our average homeowner asks about $700 a month. Our ranges between $650 and $850. Usually include utilities because it's just so hard to carve out the utility share that usually just lump it in. The people who have the homes, we call them providers, and those are the terms I'll use going through this presentation. Also have to have an income and have to be able to sustain their home with the additional income from the seeker. In agreement for reduction of that service of the homeowner's home sharing costs, people can put together service arrangements. So for example, they can reduce the expenses by cleaning the house, doing yard work, shoveling snow, or walking the dog. It's a great program for the elderly and disabled because someone can make a phone call in case of emergency. They can help set up meals, go grocery shopping, give them rides to doctor's appointments. We talked about earlier, they can provide companionship. In fact, 80% of our providers and 78% of our seekers in our most recent survey stated that they saw an increase in companionship because of their participation in the home sharing program. We don't do hands-on services like dressing, changing, helping people bathe or toileting, really anything that requires any sort of physical contact. There are professionals out there that do that. That's their area. We don't infringe in their area. They don't infringe in ours. Our application process, people can call our office. We'll explain the home sharing program to them, see if it's a fit. We'll collect some additional information from them. And of course, we've been doing it this way for 40 years, so I'm messing it up and I'm going to an online application sometime in the last quarter of 2024. They'll then submit a home sharing application with 3 personal references are required.
Steve, the slides aren't moving forward.
There you go. Like I said. Okay, so our application process. You should be able to see it now. We have an intake.
Okay, now it's going. There you
yeah, I don't get it. When they do an application, in turn, they have to provide 3 references. They can't be family members. They have to be people they've known. They can be a current landlord or a former landlord, employer, people they know in the community. This goes for both the provider and the seeker. If they're under any sort of professional care, we need to talk to the care provider, the therapist, the social worker, or a doctor. Is not to get into any of the HIPAA stuff. but it's more to find out if they're a good fit to live with someone independently in a roommate type situation. They also have to provide verification of income, whether it's pay stubs, a Social Security award letter, pension verification letter. And I know this never happens in New Jersey, if they're working under the table and not receiving a W-2, then they can get a letter from their employer stating that they are in fact receiving an income. We'll then follow up and do the reference checks. We also do a professional background check using a company called Checker. Once they clear the background checks, we have masters of social work on staff. They will do an interview with both of the people, the provider and the seeker. Their goal is to learn more about the applicant and their preference to make sure that we put them into a good fit and a relationship that'll last. When they get together, we call it matches. We want these matches to last because, as we all know, it's easier to maintain a client than get a new one. If it seems that the seeker is going to be a good fit with one of our available providers, we'll provide that name to the provider. They'll reach out just to introduce themselves, and we'll set up a meeting for them to meet in the provider's home. This has been going on now for 2 or 3 weeks. When the first applications came in, this is going to be the first opportunity they have for them to meet each other. They're going to meet each other. If they say that, hey, this is going to work, we call it a match, and a match is made. The provider and the seeker complete something we call a shared living arrangement. It's a binding contract for the living situation. It establishes things like their room. They get their own room. They have the use of their own bathroom or a common bathroom. How many shelves they get in the kitchen cabinets, how many shelves in the refrigerator, how much room in the freezer they get, the areas of the house they can and can't use. Can they park in the garage? They can't park in the driveway. Where do they park? What do they do? How do they take out their garbage? All those things are worked out in that shared living arrangement. Once a shared living arrangement is signed, they set a move-in date, but that's not where our relationship with them ends. We do what we call match maintenance. We'll check in with them at approximately 1 month, 3 months, 6 months, 9 months, 1 year, and every year after that to troubleshoot or mediate any issues that may come up. What we find usually is problems come up in the first 1 to 3 months. And usually it's something like I move in with Michael. Michael is a provider, I'm the seeker. Our social worker calls up Michael and says, how's it going? And said, you know, Steve's a slob. He said he was meticulously neat. He keeps his room clean. His room's a mess. He never closes the door. He leaves dishes in the sink, and it's driving me crazy. The social worker would then call me and say, Steve, what are you doing? You said you were going to do this. You haven't been doing it. You're not living up to your part of the agreement. And usually that fixes the problems. It's an ongoing living situation. Either party can give a 30-day written notice if the guidelines are not followed and mediation is just not working. Interestingly, the main reason why people leave our home sharing matches is not because they have issues in relationship, but a family member's agreed to take them in, or the seeker gets a job out of the area and they need to move. Those are the main reasons why our matches tend to break up. I've done this presentation a number of times, and people have always asked me for statistics of what are our clients. So these are statistics from last year. 45% of our providers are female head of household, 36% are seekers are heads of household, 60% of our clients are Caucasian, and interestingly, out of our providers, almost 37% of them are between the ages of 50 to 69, and almost 40% of them are under the age of 50. We actually have college students living down in New Brunswick in home sharing situations with seniors. So we have college students living with seniors, and those have been very successful matches that have been going on for a number of years now, primarily because they're graduate students. They move from out of state, and once they graduate, they have no place to go. So they stay with the provider during the time they're a student, then they just stay. Our accomplishments, we've had over 2,000 matches since our inception. Our longest running match right now is 24 years. Our longest tenured provider has been doing it 28 years. She is on her 7th match. So immediately what comes to mind is what happened to the other 6. The other 6 have transitioned to their own permanent housing. They were able to save enough money for down payments on either units or homes. The family she has with her right now is a single mother with 2 children. One of them is a senior in high school. The other is a freshman in college. And I met the family. And the mother said the only reason that she's able to put her kids in college is because she was able to save enough money doing the home sharing program to be able to pay his tuition and save for the daughter's tuition. And when the kids are out of college, she's going to save up that money for a down payment on her own home. Then we're going to have to find another match for that woman. We average between 1 and 5 matches per month. And at any time, we have 50 matches going on at any time. So that concludes my presentation. I will be happy to answer any questions anyone may have. And I'll leave that up to Melissa to moderate who's asking the questions.
Yep, anybody? I'm gonna look at checking the chat. It took us a bit to realize like you weren't just that your slides weren't going, that you weren't just doing an intro. So
I can
thank
do
you,
the whole show
Sandy, for
again.
that. No, I think we're good. It's a great, I mean, it's a great program. And it's a wonderful way for, especially people, who are homeowners, to be able to kind of maintain that house and not have to move out and really help, help other people, get some, have a good start for housing. So I love the part about the college students or the recent grads. The phone number back in the chat, Steve, can you just type it in?
Come in now.
And throw the email in there too. Always a good idea. You probably were going to do that anyway. Any questions?
Hi, this is Tanya from Zufall. I actually have a quick question. For when people, I guess for the seekers that are looking for houses, are they restricted to certain counties, or is it just wherever they're applying into that they could possibly find a residency?
We're statewide. So we're a statewide agency. We do have some overlap, primarily in Somerset and Middlesex, because we have some available providers in Somerset that Middlesex people move into, and believe it or not, vice versa. So the county lines are not as important to us as the placing of the clients is.
Thank you.
So I think that covered Samari's question. What county does the program cover? So kind of statewide, but you're primarily Somerset, Middlesex, Hunterdon has been like your typical area.
Well, actually, we've got matches all over these 11 counties that we're active in.
Nice. So that's great. Any other questions? Okay, thanks, Steve, for the presentation.
My pleasure. And allow me to thank Melissa. Allow me to thank everybody for letting me speak, and also a quick apology. And yes, Samari, I'll send this over to Michelle for sharing. One apology, because we're in 11 counties. I have a Union County meeting at 10:30. So
nope, you're good. You're excused. That's great. We'll share the presentation, so that'll go out with everybody with the meeting notes and the everything. So wonderful. And a reminder too, if one of your agencies wants to share what you do, it could be your agency in general, it could be a specific program, especially any kind of new initiative, or anything that's going on. We have the agency spotlight. We can do 1 or 2, each month. So reach out to Michelle if you're interested in maybe doing that again, and we'll As I did that, I muted myself. I'm not that bright some days. All right. So the next part, exciting news on our Continuum of Care program competition. The NOFO, the Notice of Funding Opportunity, was released yesterday in the afternoon. So we already have our TRC, stands for Technical Review Committee. And I'll just give a quick summary for people who might be newer to this. This has been a process that has been an annual process by HUD, where they would have an opportunity to get funding, and the county was able to bring in about 3.5 million in funding annually for projects that are renewals and some new projects that address homelessness and provide, in many cases, permanent housing, permanent supportive housing. This year is the first year HUD is moving to a 2-year cycle on this. So we'll have this year's competition, and then we won't have to do this again for 2 years. The way this works is we have a local competition to compete for these funds, in which we've already had those applications were released earlier in the spring. They were released in May, due back in June. And we've been waiting for our technical review committee for this NOFO to be released so we know our budget. So the technical review committee is made up of local people who are on this, on part of the COC, but have no conflicts of interest to any of the applicants. So they're not any of the applicants, they're not any of the sponsor agencies, they're not working with them, they're kind of completely independent. And their job is to review the applications, score them, and then rank them for this process of what we will submit to HUD. Now, not only in this response to this NOFA do we have to submit, hey, these are the projects we are endorsing and say our funding should be spent on, we also have to provide to HUD a narrative with some performance information on how well we're doing as a full COC to work and coordinate together to end homelessness. So some of it is data that they're pulling from our HIMIS online homeless management information system, or other data we've reported to them as part of our point in time count. And really looking at measures of what we're doing to end homelessness. Are we housing more people? Are our homeless numbers down? When we have homeless clients in our program, are we helping them increase their income? How long are people staying homeless? All these different measures help evaluate how well we're doing. We also give them a narrative of how well we coordinate. You know, are we reaching out to all the potential partners and all the different aspects of homelessness, of, you know, how we're working with chronically homeless people, victims with domestic violence, youth homelessness, people being discharged from different institutions. So all these things go into how well we do and how perform. What's the story we can tell? What can we document that we are doing things that should hopefully work towards ending homelessness in our community and helping our numbers decrease. So that's this whole process. So the TRC will be meeting next week. They've already all reviewed the application, so it'll really be up to them now to knowing what the budget will be to rank them and figure out what that ranking would go into. HUD, in their wisdom, they kind of look at what we've done. If we had all of our projects that we were approved previously, and if we renewed them, what would it take to run the program? And HUD allows for some adjustments, some projects. So if I have certain projects where I'm providing rental assistance to people to rent in the community, will rents go up? So HUD indexed them based on fair market rent. So that number of what it would take to renew all of our programs is called our annual renewal demand. So you might think, well, great, that's what they give us. No, they say, well, we're going to give you a percentage of that, and that's going to be your tier 1 number. And we're kind of going to guarantee that, but it's not everything. Our annual renewal demand is about 3.5 million, but our tier 1 number is only 3.16 million. So what happens? Well, we can still compete for those additional funds, but we have to put projects in tier 2. That means there's no guarantee that they're going to get funded. You're kind of competing for that extra dollar. And then there's also bonus money. And Casey can jump in with what the percentage is and anything I've failed on that, or talk more about maybe our budget in the process from Monarch Housing, who's our consultant. Go ahead.
Thanks, Melissa. So I will say that all of this, we are waiting on HUD to publish the what they call their estimated annual renewal report. And so that gives us like down to the penny the amount of funding we can apply for. But what they do is give us in the NOFO some percentages so we can make a calculation. The problem is that the one piece that we don't have is our preliminary pro rata need number, and that gets published with the geocode report that HUD puts out, and they haven't put out the numbers yet. So because Middlesex County's annual renewal demand is actually higher than their pro rata need, which has been traditionally the case, at least the last 5 years, we can make some estimates based for the regular bonus dollars and the planning grant, but we can't make any estimates yet on the DV bonus because that number is actually directly correlated to the PPRN number that we don't have. So with that being said, our annual renewal demand, like Melissa said, is a little over $3.5 million. A little over $3 million is going to be in our tier 1. And then of the annual renewal demand money, we have about $351,000 that's going to fall below that tier 1 line and be competitive for renewal. So for all of our renewal projects, depending on where you are ranked based on your scoring, some of that funding may not be guaranteed to come in. It's going to be based on our overall COC performance as well as your project application to HUD. Then in addition, we'll have a little over $400,000 in funding that we're able to apply for new projects. But like that tier 2, those tier 2 renewal projects, anything that's in the regular bonus could potentially not be funded based on how the COC scores and how your project applications score, and that's fully determined by HUD. Again, the DV bonus is actually it's 15% of our PPRN. And like I said, we are waiting on HUD to publish those numbers. So we're potentially looking at least through regular bonus renewal, we're looking at a little almost $4 million in funding that we'll be able to apply for through this cycle.
Cool. Any questions?
And we'll publish once the TRC meets and makes their funding recommendations, the full budget will be shared and published on the county's website.
And as a policy, we put the recommendations, they go to the executive committee first. We're meeting on the 15th with the executive committee, so this will be a big portion of that meeting. And then it goes to the full this full group at our next meeting for, their review and to kind of ask questions and really see it. So we'll have our next meeting. By that time, the work would be done. We'll have the recommendations and give a final formal approval of that. So that is how it will work and go. And then the NOFA itself will be due on October 30th. So it still gives us a decent amount of time to to prepare for it and to get it done. So it's kind of a busy time, busy cycle. We'll be very happy that we won't have to do this next year. Next year, the projects that are recommended will kind of almost be automatically renewed. So it's very important how we do this. Eileen, you have a question?
I do. Thank you for all that explanation, but didn't HUD just release a different sort of NOVA for permanent supportive housing support? And do you want to talk about that now, or do you want to talk about it in the executive committee first before we
No, that's on the
parameters?
agenda. That's on the agenda later, right after the committee. We're going to talk about
Oh,
that.
okay. Okay, great. Thank you.
Cool. Any other questions? Okay, so you'll be hearing more next month. You'll get this full you'll get it, completely with the recommendations of the TRC. And I just like to thank the TRC members for the work that they have done already in reviewing them, and then the work that they're going to do next week. So good luck to them on making those decisions and ranking and moving forward. We'll go to our committee reports. So our executive committee, I think that's pretty much it. We will have our next meeting where that will be our big focus on doing that. One other thing, as I'll say before we get the NOFO submitted, as part of that, the projects that get selected, and also as the COC as a whole, as we get in and start digesting this. Sometimes you might be asked as an agency to maybe provide an MOU, a memorandum of understanding of a relationship between you and then the other agency. I would encourage you, if you get asked for this, to see what you can do to get this done and finalized. That helps strengthen their application. So it might be a particular project. It might be that you've worked with them for years, really informally. We have a lot of really great relationships that just happen because we've always done it that way. We connect with them. We know, hey, if I need to connect somebody with childcare, I just call up there. I connect with, Accelera. We work with them. It works out great. But in order for them to document it, you can't just say, well, I just send it to them. It's going to sound better if, hey, we have an MOU with Accelero, and this is where we make our referrals for people who are in need of childcare. And I just picked up them off the top of my head because I know that was one that we've done in the past and we've got executed and showed the work. So if you get that request in the coming weeks and months, consider helping them, do that and helping them strengthen the application. It's a great way to, help show the partnerships that we have and to formalize that. So if you do get that request, do the best you can to really get that done. And especially with some of the bigger organizations, I know sometimes it's tougher to get things signed off on approval. But it's another way that you can help our overall system, because the higher we score this year, especially, is going to lock us in for 2 years. And if we get bonus dollars, and then that becomes in 2 years what our baseline is and evaluate it off. So we want to keep growing and keep getting additional funds each year, because it just kind of grows the pot for future years. So that's about that. Our executive committee will have our meeting. This will be a big topic with approving that ranking and going from there. Melissa Mascola, are you on for permanent supportive housing?
I'm here, yes.
Go ahead.
There's not much of an update. We did not meet in July. We will be meeting on the 29th of August, the last Thursday of the month at 10 a.m. And we are waiting on Rutgers to approve the community case management scan. So we'll hopefully provide a stronger update next month. That's it.
Thanks.
Thank you.
Consumer participation, Eileen?
Sure. As the agenda says, we meet the last Tuesday of every month at most often at Amani Park at 2 p.m. This past what are we in August? In July, we participated, the consumer consultants participated in Mission First Resource Fair, both as consumers of the information and also providers of information. We tabled there for anybody else who would want to know what consumer participation consultants are and would they like to join. And then also the consultants, some of the information that was being given so that they can share it, with anybody who comes to our committee or our committee's outreach. So as always, we would really like to have more people coming. We like it to We'd like the agency to sponsor a consumer consultant through a case manager of your agency, because that's what we've done so far, and that it seems to work that way. So if you are interested at all, you can reach out to Nicole Fernandez of Catholic Charities, Melissa Mescola of Mission First, me, or Tia Rogers of Coming Home. And we'd be happy to have you.
Great. Any questions on consumer participation or how to get your clients involved in that? Okay. Homeless Youth Task Force. I don't know if there's anybody on from that group. I know Michael Davidson's in another meeting at the moment, but they met on the 31st yesterday, and their next meetings are on the 4th and the 6th. So that's another great opportunity to get involved with that group. And Eileen, do you want to say anything with coordinated assessment leadership team?
Well, we don't have any plans for the team to meet in the near future, although I'd like to do that before the end of the year. But as an update as to our places, we have we dropped Aldersgate in East Brunswick because we weren't reaching enough people to make it worthwhile. But we picked up and we added instead the Reformed Church of Highland Park, where we go. Unity Square, of course, is full times, as is the center. We go once a week to the First Presbyterian Church in Metuchen, and also as well to Middlesex College. And Crystal, who's on the call, one of our access navigators, had been approached by a food bank in a food pantry in Edison, and we're going to try that out before we formalize it, just to see if it seems like homeless people will be coming there, because often people who come to food pantries already have homes because they're going to be getting sundry items that they can use in their kitchen. So so we're going to check that out before we do anything formal. And anybody have any questions?
Okay. So the next item on the agenda is that as Eileen mentioned before, HUD has released another notice of funding opportunity called COC Builds. And this is, Amanda, do you have a question?
Let's see. No, shoot, I can't see.
Okay, I saw your box light up like it was like you were talking, so I was just confused. Oh,
No.
Denise. I see. Okay,
Yes.
Denise, go ahead.
Yes, good morning, everyone. I apologize for being late to the meeting. This is my first time. I'm with the Public Defender's Office, and I cover a few counties, and Middlesex is one of them. Miss Eileen, we've had a email conversation, so it's nice to be on this meeting with you. I'm wondering, with the coordinated assessment sites that you spoke about, is there a flyer that mentions all of these sites?
Yes, there is. I can send it out. I'll send it to Michelle, who will send it out to the whole group, and you'll get it that way.
Wonderful. Thank you so much.
No, thank you.
Great, thanks. Okay, so the COC Builds a NOFO. This is a first time opportunity, and it's it's a pot of money available for the creation of permanent supportive housing. There's 175 million available across the US, but a good chunk of that is reserved for states with smaller populations. because they want to, I guess, hit and definitely make sure there's some resources in some rural areas. HUD is anticipating about 25 awards. There's a minimum of $1 million award, and is the minimum you can ask for. The max is 10 million for even the largest communities. Ours would be, we're capped out at 5 million based on our population in the area that we cover. Out of this request, 20% of the requests could go for supportive services and operating costs, and 10% can be program admin. We don't have to ask for the full 5 million. It's based on a project. You're allowed one application per continuum of care. So one that would come from the county. So we can't say like, oh, great, we have 3 or 4 projects that would equal 5 million and we want to, do them. So it's different from the other NOFO. This is, you kind of have to pick one project up to 5 million, a minimum of 1 million. And what they're looking for in the applicants is they want to see that they have some site control. They want to see that that developer has documented experience. I think what they mention is at least, doing 4 similar projects at kind of a minimum. They want the ability to leverage other resources. So you're not looking for this HUD to do this whole project with just the HUD dollars. And for funding, you have to be bringing other funding to the pot. And they mention, examples would be like tax credit projects. The county here has its Housing First Capital Fund, which is used to create homeless units. It might be if you had a project with any of other state funding. If you had home dollars, home ARP. So there's some other resources that they would want to see leveraged. And the county does have some potential to leverage some of our resources with whatever the project would be. I think at this point, the county would be interested in applying for this as long as we had a project that would kind of meet the criteria and have a good chance of it. So we kind of have to look at what the criteria is, knowing that they're only gonna put 25 awards across the country. I don't know if you know off the top of your head. I'm going to challenge you, Casey, how many COCs there are across the country?
Oh, that one I don't know.
Oh, okay.
A lot. More than New Jersey has a lot for the state. We have 16 within our state, and that is definitely not the norm. So when the one thing I do know is that when you look at the to speak to your point, Melissa, of the amount of money we can apply for, we are actually along the bottom tier of communities with an annual renewal demand of less than $10 million. The top tier was COCs with annual renewal demands over $40 million. So as you can imagine, like Melissa said, this is going to be a pretty competitive process. So, and some of those awards are set aside for states that have less than 2.5 million people in them, and for rural communities or Indian tribes. So I will just say it's less than actually the 25, with I think they have 3 awards set aside for those populations.
We got an answer in the chat saying more than 400 around the country.
That sounds right to me. I think California alone has 40.
Okay. Yeah, many smaller states might have a COC. Like I think Indiana has one covers like the greater Indianapolis area, and then something called the balance of state. And I think a lot of rural states are similar like that. So it's going to be highly competitive, but we think if we have a good project, there's no reason why we shouldn't apply for it. It's a two-part application again, one part for the project and one part for the COC to do. So it is a lot of work. They anticipate the period to kind of cover that. They'll have these, if you're selected, we want to start work by next fall, and then kind of have everything completed within a 5-year time period. And this NOFO is due not quite a month later than the other one. So it's a lot of similar work happening at the same time. What I think we might do as a COC is we'll have some maybe opportunity of like, hey, if you're interested, let's have a conversation and let's see if we have any prospective projects, and start off with that, an opportunity for our developers to kind of sit around, talk, not a formal TA, but just see if there's some interest. And I think we would want to get that going right away. Because if we don't have if we don't have developers that have a potential to apply for it and kind of get that feedback, I don't want to necessarily start a formal process and put a formal process out. If we know we have that interest, then we'll do a more formal process similar to what we do for the regular NOFO, in that we'd have a local application type process where you would talk about the projects. We'd offer technical assistance with that, how to fill out the particular application, what we're looking for in the answers. So we would have to get that going pretty soon, but I kind of see that first with maybe like, hey, just an interest call, we'll put it out there. Anybody who wants to kind of talk about it more in an informal setting, ask some questions, because the goal would be to really get, the best potential project. Lori, you have a question.
Yeah, I'd be curious to know from the COC's perspective, where you think the money could be best spent. So, for example, more family units, units for individuals, some kind of, SRO type model, youth housing.
It's tougher to say because we have a great need for all of those. I think it's going to be what makes sense for the project. The toughest part is going to be having a project that you might have some level of site control over, but that you can wait a little bit maybe to hear on some of the funding. So it's kind of a weird time frame. So you have to have enough of it together to put together a competitive application in a couple months, and knowing where you could get leveraged resources, where we can get some other resources. Hey, we have site control. Hey, this is going to work. But not understanding you might not get an answer from HUD for several months. So that might not, it's going to be kind of a weird part with that. So I think it's probably some projects that people have had in their mind of what to do. Maybe the best ones that could work could be something that might be a conversion or a new build that you own property on. So I think you probably have to have a concept. So we're not going to get to the point and dictate that, gee, our first priority is, SROs or, units that can fit, 3-bedroom units. I think it's all of it is potentially needed. So what you can put together and what we can help, maybe leverage resources. I think the toughest part's probably going to be finding the ongoing housing subsidies for it. So like if you can get a PHA to put some project-based, vouchers in, that would be a good part, a good potential to maybe, maybe do. I knew the city of New Brunswick had some available at some time that they were, making available for project based, but then, you have the property there. So I think it's, when people kind of look at what can be competitive and what you have to do, I think it'll become apparent if whether you have a project or not. If that makes sense.
Yeah, thanks.
Yeah. Go ahead, Frank.
So, Kimmy? Yeah, Melissa, I got a question. We have a developer that's partnering with our organization. For Middlesex County, would they be able to come out of another state, or do they have to be located in New Jersey?
No, this is for Middlesex County. So are you talking about the location of the project or the people?
The people. The project will be in Middlesex County, but the developer are in another state.
Oh, it doesn't, we don't care where
So
the
I'm
developer
trying to
is.
understand.
So the developer, we would, I mean,
Okay.
you know, if it was a bigger developer, sometimes like we have developers who come in and apply for Housing First Capital Fund, and maybe their parent organizations out of state. That's not an issue. It's just that they have experience. They have experience in doing this type of development. I mean, I think if it was an entity we're not familiar with before, or they haven't done projects in New Jersey before, that would probably be, you know, they probably wouldn't do so well locally, because, you know, if New Jersey has different rules about getting something built. So somebody who hasn't worked with the New Jersey level of review and isn't familiar with the area, or doesn't have local municipal kind of connections or whatever. So there's no prohibition on where the developers fund from. Any project that would go in, because we would anticipate the county, you know, if they were going to endorse a project, committing and allowing some Housing First Capital Fund to probably match up with this. But with that, you would have to then also obviously commit to taking from the coordinated assessment and prioritizing our people and doing that part. I'm going to just share really quick. I go back up here. I got to find here, and I don't know if I need to make this bigger. This was the part from the NOFO that just kind of talks about it, and I wanted to just highlight here where they're putting here this part. HUD has the following 3 goals for this competition: affirmatively further fair housing by addressing barriers that continue segregation, hinder access to areas of opportunity for protected class groups and vulnerable population, and concentrate affordable housing in under-resourced areas, increase the supply of permanent supportive housing within COC geographic areas to address homelessness for individuals and families experiencing homelessness where one member of the household has a disability. So to me, then that speaks to, you know, the way we prioritize it. I mean, I think we'd want to say we're going to prioritize for chronic homeless. They always have a disability if possible. And then ensure new permanent supportive housing units are easily accessible to local services, reliable transportation within walking distance. So, so those are what they're kind of looking for and what's going to make a competitive application. So having a project cited in an area where there's, you know, there's no transportation, there's no stores, services, things connected, you know, if we don't have too many areas like that, but you're not dropping them in the middle of, you know, a farm area in, you know, in Cranberry or Plainsboro or a more rural Monroe area away from everything. You know, it has to be connected with stuff. Does that answer your questions? And did you have any others, Frank?
Yes. Because, well, you know, it answers. I was just trying to figure it out. And what you just said, it makes more sense. So if you do find a location, say if it's not next to a lot of stores, and you do provide transportation with vehicles that will take the residents to those locations. Can you make something in like that?
No, I mean, that's all part of the application of how you would address that. So, you know, you might say, hey, well, this area,
Okay.
you know, here's what we have. We plan, and I see, you know, tax credit projects do this all the time. Hey, you know, here's the area we have. And here's what we're going to do. We're going to have a regular shuttle that's going to be able to take people here, there. We're going to connect with this program, you know, that has, you know, different availability. I mean, it's very hard to hit everything because you talk about them not wanting to have concentrate affordable housing in under-resourced areas, or kind of, hey, here's where we put all, you know, here's where we put all the affordable housing, here's where all the poor people are, and there might not be, maybe there's not jobs or things. So it, you know, it's a balance. It's going to be hard for a project to excel and be at the top of everything, but you have to find ways to address it and make it make sense.
Hey, Melissa, can I jump in for a second? It's
Please
Casey.
go ahead, Casey.
Sorry. So I just want to, I have this little cheat sheet that I created after I read the NOFO, and I'll be happy to share that with Michelle to share out to you guys.
Great.
But there is, I just want you guys all to be thinking, like, I know that this affordable housing, we need more affordable housing, but for us to be competitive nationwide in recommending a project forward, we need a project that already has or can have secure site control with proof of being able to secure site control by next September of 25. We need, you know, there are some pieces that kind of already have to be in process. And so there's a leveraging commitment requirement of at least 50% of the amount we're requesting in funding from another source, be that, you know, low income housing tax credit or National Homeless Trust Fund or whatever it might be, or a commitment of vouchers that you can already provide proof of for 25% of the units. So there's a lot of pieces, you know, I think, well, it's important to explore new opportunities. I don't know that that's going to be a viable project for this specific funding opportunity because of the deadlines HUD's putting on it. There's a lot of written commitments and contracts that you need proof of to be able to already show. And so, or be able to get those commitments and contracts in place within the next 2 months to be able to move a project forward. So I just want to be really clear that in all likelihood, a project that's going to be competitive needs to be one where there is already site control or the ability to prove there will be site control within the next year. Already having leveraging funds of at least 50%, or the commitment of vouchers to support the units that are going to be developed, as well as showing some healthcare match commitments. So between supportive service providers, things like that. So I just wanted to make that clear that there are some, like, HUD's putting some pretty stringent requirements around the projects we can move forward. And I'll share that like list of that kind of cheat sheet out to Michelle so that she can share it with you.
And we'll use that, Michelle, when we send that, let's send that as a separate email about this, and maybe schedule like a time where we can talk a little more detailed and go over what the basic is. It's really something you have to have. Like I said, it's almost like you had to have a project in mind or almost queued up, and it becomes like, oh, here's the funding that we need. And unless something really comes in, I would anticipate that we'd probably make a smaller ask than 5 million, because if you're looking at that level of match, you're looking at a $10 million project. I don't know of anything offhand that hits that. Susan, did you have some questions? Or did Casey scare you away?
I'm looking forward to that list, but I have to say that we have a project that we've been queuing up. And it looks to be like a $7 million project. So, yeah, we have site control already, or we're very close to finalizing the agreement with the church. So I don't know if that falls into this, and I don't want to belabor this for everybody else, but just wanted to put that out there.
And Susan, I just want to thank you for highlighting that, because while I don't mean to scare anyone off, I do think there are existing projects in the pipeline. I won't pretend to be an expert on housing development in any way, shape, or form, but it's my understanding that there are, that there are existing projects that are always in the pipeline and always looking for gap funding. And so I think that Middlesex as a community is absolutely going to be competitive to get some funding, and likely has quite a few projects, as long as we can target the correct, the right developers to come in for this opportunity.
Yeah. Great. Did you have any other questions? So it's an exciting opportunity. We'll see if it works for that. We have no indication if this is a one-off or if it's going to happen again. I think a lot depends on, this is all at the federal level. So we'll see what happens in future years, with elections, with budgets, with who's in Congress and who decides on what funding they're putting towards these efforts. All right, so look for more information coming out very soon on that. Next item on our agenda is, if you remember, making shifts happen. And this is our reducing homelessness, and our COC requires everyone's efforts. So you remember at our June meeting, we kind of pitched this making shifts happen as kind of our catchphrase to capture all the work that we're doing system-wide to work towards ending homelessness and having a shift, meaning if we're looking at our data, if something's supposed to go down, like the number of people homeless in our community, we're shifting down. If something's supposed to move up, like the number of people connected with certain services that we're doing better of, that we're having shifts that are up. The number of housing placements we do in a month, that would be a shift that would be up. So all of the work is we're making shifts happen. We want to see movement. We don't just want to kind of run in place. And if you think of a little dot chart, we don't want to just kind of have the same little bit up and down. We want to see shifts. We want to see changes. So it combines the work of 3DM. And if you remember, that was data-driven decision-making, and a program that we were awarded with the state to be able to participate in some really exciting work on working towards ending homelessness and having access to people, facilitators from the Harvard Kennedy School of Government Performance Lab, and also continued work with Built for Zero with Community Solutions. So we've been doing Built for Zero work at different levels for the past several years, and working on having good data and clean data. And the people who attended our June meeting, you remember we had our 3DM presentation about looking at housing placements and the length of time someone is homeless before they find their permanent housing solution. And what we saw in that was that people who were older and seniors took longer to find housing. Like the older you were, the longer it took you to be able to exit homelessness into permanent housing. And then if you were a person with disability, regardless of your age, it took a longer time for you to be placed in permanent housing and to find permanent housing. So some of the suggested strategies was to have a survey for seniors. I think we're saying pretty much anybody 50 older. I don't know if we'd even go 40 and older, just kind of seeing what were some of the challenges that they have, both currently current homeless people and people who were previously homeless. Some of the things that we might have presumed out of that, it might be some technology challenges. Many of the places to apply for housing is all on online applications. So you need to have access, you need to have savvy on how to do that. It isn't like I go to different apartment complexes and, you know, it's harder to do things with paper application. Things are more online. Does that present a challenge? You know, what are the challenges with people being able to find housing and what are the difficulties? So if we know what that is, what those challenges are, we can help address them and target some needs to them. A concerted use of mainstream resources, making sure all the people who are homeless in our system and who we're working with people are knowledgeable about the different mainstream resources that are out there and how to make those connections. You as a case manager don't have to have all the answers and all the resources, but you should be able to steer people to those resources and know what's out there. So we always want to make sure, especially in times of a lot of changing staff, some people don't know what's all available out there. You know, that's one of the reasons we do agency spotlights. We want to make you aware of different things and know what that gets in. And if you're an agency and you know, you're an executive director or a higher level person and you're up and you're attending these meetings and you know about it, well, that's great. We got to make sure it's filtering down to the staff. We also talked about another potential solution was to create a DASH-like program. DASH is a program that the state started a couple years ago. It's like document ready for housing, helping people who have a housing subsidy, who get awarded a voucher through the state, help them if they need to get documents together to find their housing. So documents could be ID documents. Sometimes, you know, in the rush when you're homeless, you know, you might not have access to where your birth certificate was, your social security card or information to document that, how to document your income if you're receiving SSI. You know, how do you have your award letter handy, how to get all that documentation put together, and someone really to just helping you do that. It takes that even to apply. When you apply, when you get awarded a voucher and say, hey, great, you have to go meet with your, you know, the housing agency, you have to bring a bunch of documents with them to even get that voucher. So you have to have, you know, documentation of IDs for, you know, birth certificates, social security cards for all the members of your household. And it's really can be challenging if people were born in other areas and, you know, other states or even other countries. So the DASH program or a DASH person would help them do that. So we have that. Catholic Charities was awarded the grant here in Middlesex County, but it's just serving people who receive vouchers through the state program. So we might want to expand something to have a similar type of position here in our county, that we can do it for people who get vouchers, you know, anywhere in the county, or who get maybe rapid rehousing assistance even. So we're going to look at maybe what it would take to establish and create a program like that, and if that would be helpful. We had talked about that a while ago, and it was identified as a need for some case managers. You know, then they have to become experts in where do I go to get documents. So to have someone whose kind of main job is to do that, that would be a way to make that happen. Again, here's our Built for Zero aims and goals. We don't know if we're going to hit these goals by the end of the year, but we're going to continue working through them. And basically, if we want to end homelessness or really work to having a reduction in homelessness, we got to kind of target in those things. Why do we have so many people homeless? Well, it takes a long time to get people housed. We knew that. Our 3DM project told us that. So we want to increase our housing placement opportunities. We want to make sure we have more chances for people to get placed in housing. Make sure we're using our case management services the best. So if we increase the number of people we place each month, that'll help our number go down, give us a good shift. We want to reduce our chronic homeless number. They're already prioritized for housing opportunities, but we know it takes a long time for them to be housed. What we want to do we need special resources to really help people with disabilities find housing? What do we need to do? Some of the survey might help us with that. And the other issue is we have people that they're in our, they've been homeless 5, 6, 7 months. Well, and they might have a disability. Well, let's make sure we try to get them housed before they become chronic homeless, before they hit 12 months of homelessness. So let's not keep people with disabilities homeless for a longer period of time. And then our third goal is then to make sure we're decreasing our inflow. So we don't want people to become homeless or return to homelessness. So we have really good statistics. Once we get people housed, they tend to stay housed because we put a lot of effort and resources into keeping people housed. So our recidivism rate is very low. We can work maybe on improving our prevention resources and either bringing more resources in or how we target to make sure when we're sharing and doing prevention, we're targeting the people most likely to end up homeless in our system. And we know some things, if people were homeless before, there's a greater chance of them being homeless again. If you've been involved with certain institutions, if you've been in foster care, there's probably a greater, it's an indicator that you have a greater likelihood of being homeless. So all of those things would help us. These are kind of the 3 target areas. If we work in, we can drive that number down. So it's really kind of tangible things that we can do to help these action steps and decrease that. So we're excited with one of the big initiatives in this work is this past a couple weeks ago at our last commissioners meeting, we awarded a contract to Catholic Charities for the housing support team, which is something we've been talking about for a while, finally came to fruition. The housing support team is going to be 2 full-time people, a housing navigator and a housing placement liaison. And the housing navigator is just going to be out there finding landlords who have vacant units for homeless people in our systems. And just continuing working with landlords and identifying them, getting them to know to reach out to us when they have availability. So maybe even finding smaller landlords who don't have any availability now, but know to contact us when they do. And that, hey, they don't have to advertise. We'll get you somebody, and we'll get you someone who has a housing subsidy, and where you're going to probably get the majority of your rent from that housing subsidy program. So you have a good, a good steady, rent stream. It's, maybe less risk than taking somebody off the street who knows if they're going to pay their rent or not. Hey, and then not only are you going to be getting a good portion of your rent from this housing program, you also have a case manager. They're going to come with a case manager, and they're going to have this housing placement liaison who is going to be a person you could call if you're having trouble with that landlord, or if that landlord is having trouble with a tenant. That housing placement liaison is kind of going to be the person to just make sure when we have a homeless person with a subsidy or even without a subsidy who matches up with a unit maybe identified by the housing navigator, that everything works right for them to be able to move in on time. So it's going to be working, if it's a voucher, working with that housing authority or housing agency who's issuing the voucher. Do they have everything they needed from that homeless tenant? Do they have all their documentation to make sure that moves smooth? Is the property being inspected? Connecting the landlord with that housing agency. Just making sure the tenant's doing whatever they need to do. Are they connecting with their security deposit? Do they need to apply for one? So that housing placement liaison is helping initially get that person into housing, and then they become that first point of contact if there's an issue on the landlord or the tenant side. You know, if the tenant's having trouble with the landlord, maybe fixing something in the apartment, that liaison could help be that like mediator. If there's issues, if the landlord's having issues with the tenant, you know, breaking lease violations, you know, they can hopefully get it addressed with having somebody sooner before it gets bad. We want to know if that tenant's not paying their rent, even if it's a small portion. If their portion's only $50 a month or $100 a month, they should still be paying it. We want to know that that's happening. So that housing placement liaison kind of becomes that middle person who they're connecting with all the different bodies, and it's not like, wait, who was that case manager? I have to remember to wait, were they with VOA or are they with UBHC, and case managers change? It's going to be one person. So those landlords will know, hey, this is the person that you need to speak to. So we're excited to get that launched and started. To help them on their way, the county has purchased a program called PadMission, which is a software program. It's going to be able to maintain the housing inventory, track the progress, see how well we're doing with that. And we did it that way as opposed to making the agency do that, because there's no question of who owns this. PadMission's owned then by the county. So all the work that's putting there is maintained by us and this, you know, and the COC for future use. So if the agency changes in the future and another agency comes in or something else goes in, or if we can expand it to others, you know, it's staying here with the county. So we're just really excited about that and hope that that's not that we hope, we know that's going to help us achieve some of these goals, especially of increasing housing placements and decreasing the amount of time someone stays homeless because they can't find a unit. It's kind of taking the onus off case managers to have to be housing specialists and leasing specialists, that, you know, they can work on some of the other parts of their case management duties. So that's exciting. I don't know if anybody has questions on that. I don't know if Nicole wants to mention anything about that. I'm putting her on the spot.
We're excited. We submitted job postings, so we'll start interviewing for the 2 positions, and we look forward to getting it started.
Thanks. And we specified when we did put it out there that we were looking for full-time positions. We didn't want, this is not something people do part-time. This is full-time, dedicated to this purpose. Go ahead, Linda.
Yeah, I just want to clarify, Melissa, you said that these 2 positions are only for rapid rehousing or for DCA voucher recipients?
Oh, no, the other program was for DCA. We anticipated primarily first being for people who have vouchers or rapid rehousing, but it won't necessarily be limited to it. So if you have people or people who are able to rent on their own, I used RRH as just a catch-all, but it could be anybody who's getting a subsidy for housing to help kind of link in and find, you know, find housing, or people who might be able to afford it on their own.
Okay. Well, yeah, okay. Could you just help me then with the agenda? What other position then were you referring to that was specific to DCA voucher holders?
Oh, that was the DASH program. The DCA,
Oh, the DASH program.
yeah, the DCA it has it first, and it's limited to their people. Under that program, we're looking to expand it and do something similar for other people who might need the same type of service. You know, maybe to see if we can fund a position that would kind of focus on helping people get documents, being that document expert.
Okay, I understand. Thank you for the clarification.
Oh, no problem. I know we're throwing a lot at you today. Any other questions? So we're excited for that. You'll be hearing more about that as it's launched and happening, and we'll see how it's going. It's also set up where we'll be having a constant feedback loop with the housing support team from our COC, leadership side and working with them to do that. So Eileen, you have something to add?
Yeah, not just to the housing support team, but to everybody for making shifts happen. This is the leadership team who's been part of this, who's been part of 3DM, part of Built for Zero. We're going to try to spearhead the implementation of this, but nobody can do this alone. So everything has to be designed and constructed and agreed upon by everybody in order for this to work, else it's not going to work. And like we talked about in June, for the time being, we're hoping not to have to structure or call or convene new meetings, but to use the meetings we already have. And specifically, like the case conferencing meetings and the case manager collaborative, because I think what's really important is, at least for maybe all of them, but at least half of the initiatives that we've already identified, is to get the insight from the people who are on the front lines. And that's the case managers and the access navigators and the outreach people. So that's why I have invited all of my case managers and access navigators. I'm like, you guys, this is not like a top-down initiative. This is a bottom-up. This is everybody together doing this. So actually, my team got together and did a draft of the senior survey. And it was interesting because based on their experience, they're like, I'm not sure technology is the only reason. And so I was like, okay, so we should ask this question, this question, this question, as long as we're going out with a survey. So that type of input is super important and super valuable. So, but it's not just going to be the Coming Homes team. It's going to be everybody, especially like on this type of thing on the front line. And so we're going to present the draft to, I guess, probably the next case conferencing meeting is probably happening before the next case managers collaborative, but I could be wrong. And we want to get everybody's input as to this, because this is not going to be a survey that is handed to you and you're like, oh, another thing I'm supposed to do with a client that somebody gave me to do. No, this is something that we're all going to create, and it's going to be our survey, so that it's going to be your survey that you're using with your clients, not something that doesn't make any sense to you that you're just required to do. Does that make sense to everybody?
Absolutely. And I see Cassandra's putting in the next case managers collaborative meeting is on the 9th.
Good.
And there's also a case conference call on the 27th.
Terrific.
So put that in there. And the feedback, really, we've always said the best answers come from the people closest to the situation and the issues. So we want to know what we can do better. And really, this is a commitment to what can you do. We're not going to ask you to work more, but maybe different. What can you maybe change the way you're doing something that will give you better outcomes?
And just maybe a different focus for a time being until we pass this. But nothing's going to happen unless everybody works together.
So that's good. Any questions on this work? And so again, you'll be kind of focusing in on it on all of your different on different subcommittee groups, on different work, anything that you need to do and are getting together. And if you're again from an agency, share this from the top down, what can really work the best. And what you can do. And you'll be hearing of different opportunities and trainings and things that we have. We had a question, is the case managers collaborative meeting open to all agencies?
Yes. Just get in touch with Cassandra and let her know and give her, if you're not currently on the listserv, she'll put you on it.
Cassandra, can you drop your email in? Perfect. She was already there. She had it up before I could even finish it. Thanks, Cassandra. Any questions on that? Okay, agency announcements coming home.
Nothing in addition.
Okie dokie. So I have an announcement here. The county is having a housing policy summit on Tuesday, August 13th at starting in the morning at 8:30 with registration, program at 9 at Middlesex College. And it's really on the new affordable housing law, how it impacts municipalities and how they can meet their affordable housing obligation. The program's really exciting. We're going to have in-depth talks about the law. So the good news is a lot of municipalities are now going to be have affordable housing obligations. I guess they always kind of did before. There some of the laws it talks about when you do certain special needs housing, it kind of counts extra. So I think they're going to have a receptive audience for it. As of earlier today, I think there was 122 registrants. So it's a big amount of people who are going to be there. Eileen is one of the guest speakers and kind of talk a little bit about what Coming Home does and kind of how they can use how municipalities can use agencies who do housing for homeless or special needs type of housing. Other speakers, Frank Piazza, who runs affordable, who has Piazza and Associates, who's the affordable housing responsible for running affordable housing programs administrator, I guess is the term I'm looking for, different towns. But it also worked in Cranberry and Plainsboro, where they formed some nonprofits to help develop some affordable housing. We have a Habitat for Humanity and a tax credit developer also going to talk about what they can do for programs. Somebody from HMFA will talk about different funding opportunities there. We'll share, I'll talk about some of the county funding that's available. So it's really going to be a nice program. It's short in that it's only in the morning. There's opportunities. There's going to be some tables with some different affordable housing providers that are going to be there. So it's an exciting event. You think you've already been getting invites. You'll probably get at least one more. I think one came out a day or two ago from the county, from Middlesex County. So I'm encourage you to sign up and attend that. We did get a notice which was shared to you from DCA, the Smart Move program. This is initiative that they had. They were looking for municipalities who were impacted by Hurricane Ida, which included Middlesex, to sign on and try to have the development of single family properties to be sold to low income home buyers. I think to kind of replace some housing that may have been impacted by Ida. There've been a lot of Blue Acres buyouts in areas, so the properties can't be located in flood zones. So trying to take maybe areas or towns where stuff can't be built anymore, but where it could be built in another area. So it's a little different. It's single family properties. It's looked to be sold, but it's still low income home buyers. So we know a lot of the work we do, or a lot of our developers do, has been more about rental housing. But if they're able to do a home buyer opportunity or model, they're looking for, it doesn't all have to be on one track. I think there's potential for some scattered site, but they're looking for any development to be at least six units in total. So if you have a developer or you know of anybody who might be interested in that program, there's the link there, or looking to check that out. And we also have that the county's homeless trust fund is accepting applications for next fiscal year. It's on the county website. The link is there. This is different from the Housing First Capital Fund. That fund is strictly for affordable housing development. The County Homeless Trust Fund can be used for more support services, some different programs. I'll hit the link here. See if this all works. Maybe. There we go. See how far down they buried it. Okay. Here it is. Down here. So here's the application and here's the funding priorities. I'll do that part. That's probably the most interesting. So we prioritize support services as may be required by homeless individuals to maintain or obtain or maintain affordable housing, prevention services for at-risk, rental assistance vouchers, tenant or project-based subsidies for affordable housing projects. And although it's an eligible use, it's a lower priority acquisition, construction, and rehab of housing projects because we have other, we have the Housing First Capital Fund for it. So it's an eligible activity under the legislation. We're allowed to have a county homeless trust fund through state legislation. It's been in place for about, I think, over a dozen years now. We might be in our 12th year. We primarily have been using the majority of the funds to fund our Veterans Housing Assistance Program, which is a rapid rehousing prevention program for veterans, and also support services through Coming Home. But there's enough funding now that we can open it up for other agencies to apply for it for their programs. So that is here on the website. The applications are due on September 10th by 4 p.m. So you have another month or so. The application isn't terribly difficult. It's a lot with narrative, and then there is a county homeless task force who will be the ones who will be reviewing the applications and making recommendations for funding. Are there any questions on that? Okay, are there any other agency announcements, business, anything else happening?
Well, I just want to say, if anybody does have questions about the trust fund applications, please feel free to email me. I'm happy to take the time to talk with you about it.
Thanks, Michelle. Anything else happening in your agencies you want to share?
Hi, it's Lori. I just wanted to remind everybody that the Central Jersey Diaper Bank is still providing diapers for people. They're not doing open distributions anymore. However, the office is open Monday through Friday from 9 a.m. to 3 p.m. And you could give them a call at the number that I'm not prepared to give right now, but you could look them up, Central Jersey Diaper Bank. So you can refer clients there. Right now they're doing 1 week worth of diapers every 2 months. If it's a new client, they need to bring birth certificates for the children that they're asking diapers for, or a letter from your agency confirming the names and birth dates of the children in the family. Yeah.
Okay. That's
Looking up the
great.
number.
Yeah,
Sorry
I was
about
just
that.
looking.
Yeah, and the number is 732-296-9922. Again, 732-296-9922. I'll put it in the chat.
Oh, I was just putting it in.
Okay. All right.
I was looking it up. So,
It's okay.
right, 9922.
Yep, 732-296-9922.
Okay. Any other announcements? Okay, then we'll just do a motion to adjourn. Anyone?
So move. Motion to adjourn, Carolyn.
Thanks, Carolyn. We got a second?
I'll second it, Melissa. Stephanie Evans.
Hey, thanks, Steph. All right, everyone. Thank you. We'll adjourn this meeting 11:18. Enjoy the rest of your day and summer, and we will see you in September 5th. Take care. Have a wonderful day.
Hi, everyone.